I'm Rita Di Matteo from Region Abruzzo, working in the project from the very beginning.
Okay. Do you want to tell us a little bit about what your colleagues found when they started talking to kinship carers? What were the things that the carers said were most important about their lives and the problems that they faced?
The most important thing that came out from the carers was that there was not enough information, and so they couldn't have all the details of how to carry out their problems and how to go on with their situation with the parents or with the children. So they were asking to the professional working with me to have more details and information on how to manage the problem.
So what you're saying is that information was really important to them about how do I deal with the problems of the children that are growing up? How do I?
They want a wider information how to help their children, their grandchildren, how to get resources to manage the problem, how to afford their parents, because first of all most of them were not aware of what happening to their parents, to their and so at the very beginning they couldn't know what was happening.
Yeah.
When they realized maybe it was too late or was not, they didn't have enough information how to help them. So this was one of the things. So first of all, they want to know the problem,
Yes.
and then how to afford it, and then how they can help their grandchildren, and after of all, how to achieve to go to the services, and if there are some financial matters that can be
that can be brought to bear.
yes.
Now, L'Aquila very famously had a huge earthquake during the period of this project. Has that had an impact on how you've been able to work?
We have a very, very big negative impact, but the professionals were so skilled to overcome most of them. The first problem was how to find where the carers went, because after the earthquake, L'Aquila was had a lot of problems of housing, and most of the carers went away from there, most of the person, not only the carers. And the first problem was to map where they were living. They didn't achieve to know where all of them were. And then the second problem was where to carry on the activities, because their building was not destroyed, but they couldn't go there because it had been damaged. So they had to work in tents and have to let the carers know where they were working, because it was not easy even to give them information where they were. And then last but not least, it was important to help them to go over the problem, because now they had
Other problems as well.
Problems besides those of the drugs and alcohols of their parents. They didn't have houses, they didn't have clothes, they didn't have anything. So everything was on the charity of the local government.
Yeah. Now, despite all of that, you've been doing some really impressive work, or you and your colleagues have been, in developing a response tell us a little bit about what it is that your colleagues have been doing.
So after the first mapping of and finding where they were, they had to help them to how can I say, find themselves once again. It was not easy for them, because first of all they had to afford their own situation, because they have lost their houses, some of them have lost their parents, and so first of all they have to manage their real situation of themselves, and at the same time help other people to overcome them. And this was a very, very hard job, and I have to say that they were very professional to be able to split this two situation, manage their own problems, and help the other people. And at the end, they have helped themselves and helped the other people.
So they've done that through having sessions with other parents in schools, is that right?
Yes, as I told during the meeting, the idea was welcomed by the directors of the schools, because it was a project targeted on a different group of the others. And so all the schools where we went to present the project were willing to host it, and even the feedback from the parents was very impressive, because with all the problems they have, a lot of them have said, okay, we want to participate, but not only on the paper, even participating to the meetings. That at the beginning they only came for curiosity,
yes.
But then they were involved in such a way that now they are asking even for another section, another training section. At the moment it will not be possible because we have other schools, but it's not excluded that we can think about going on.
And so the program is a 4-week program that's aimed at parents, and kinship carers take part in,
yes.
in that program as well. And it's focused on communication, is that right?
Communication, how to communicate with children, how to help them to overcome problems, at the same time normal problems, but even with big problems as alcohol and drugs.
The final thing that I want to ask you, Rita, is if you were considering what you've seen and learnt over the last 2 years, is there a message for the European Union or for your colleagues in local government in Italy or across Europe that you think, okay, this is what I would really like them to know about this project and about the situation of kinship care?
Oh yes, for sure there is something that could be a message that we could give to the UAE Commission and even the local government, that more attention has to be pointed on such big problems, and more information has to be given, because most of the times the people don't know where they have to begin if they have a problem. So if they have more information, so they receive feedback or some inputs from the local government, they could even overcome the problem.